The mission of Bristol-Myers Squibb R&D is to develop medicines that make a difference for patients with serious disease. It's very important to know that we're dedicated to looking at diseases that have a high unmet medical need. We believe that fibrosis is an important area of investigation. If you think back just in the past 5 to 6 years, our understanding of the biology of fibrosis, fibrosis of the lung, fibrosis of the liver, fibrosis of the kidney, has increased dramatically.
What makes Bristol-Myers Squibb unique in the liver fibrosis NASH space is firstly our focus on translational endpoints in both our discovery and clinical research, and our emphasis on the advanced NASH patients, those with F3 and F4 liver fibrosis.
Our goal at Bristol-Myers Squibb in liver fibrosis research is to try to determine, can we develop agents that can interrupt the fibrotic process? Can we develop agents that can approach and treat patients who have nonalcoholic steatohepatitis?
Nonalcoholic steatohepatitis is a chronic condition of the liver associated with obesity and complications of the so-called metabolic syndrome that includes things like hypertension, hypertriglyceridemia, and diabetes or insulin resistance. And within the liver, NASH is comprised of a series of findings that include fat, as well as inflammation, ballooning, which is a specialized kind of cell death of hepatocyte, and lobular inflammation. We think of NASH as being advanced when scarring or fibrosis begins to accumulate, because we've learned through many studies over the last 10 years that of all the features under the microscope that comprise NASH, the one that most clearly predicts outcomes or ultimate deterioration in cirrhosis is the amount of fibrosis or scarring.
The fibrotic component of NASH is scored on an F stage, F for fibrosis, from F0, where you have NASH without any scar tissue, all the way up to F4, where you have full-blown scarring in the liver, referred to as cirrhosis.
The morbidity and mortality associated with advanced NASH is almost entirely attributable to the advanced scarring that can occur in this disease as it progresses. And specifically, that morbidity can include cirrhosis and ultimately its complications, which include variceal hemorrhage, accumulation of fluid in the abdomen or ascites, and very importantly, the encroaching risk of hepatocellular carcinoma or primary liver cancer.
Bristol-Myers Squibb feels it's critical to be developing non-invasive markers, not only to diagnose a patient, but even more importantly, to assess a patient's response. A biological marker can be a blood test, a urine test, even an assessment of an exhaled breath from a patient, or it can be an imaging technique.
At Bristol-Myers Squibb, we believe that collaboration with our academic partners is crucial to our success. We know that the insights into the disease process happens with physicians who are taking care of patients and scientists who are working in the laboratory.
I really believe that we are very close to finding a combination of imaging and circulating biomarkers that will allow us to move beyond liver biopsy as a means of diagnosing patients and giving clinicians the tools to track their patients' response to therapy and their progression of disease.
At this point, we believe that the vast majority of patients walking around on our streets in this country with NASH are not diagnosed.
What's really important to understand is also a need to invest in increasing awareness for both patients and the providers and the general public about what's NASH, what's the patient's journey. There are many patients with NASH who have been told they have the diagnosis, have come to understand how serious it is and what the long-term complications are, and at the same time feel they have no treatment options. Every day that's a motivator for me and my team to be working harder on exploring and developing therapies for NASH.
Bristol-Myers Squibb is committed to developing drugs for patients who have fibrotic diseases. And so we think this is an important part of meeting a very critical unmet medical need.